Since it's our goal to help you prevent tooth decay and keep your natural teeth for a lifetime, we want you to understand the process of tooth decay, start to finish, so you can take steps to stop it in its tracks. First of all, thousands of bacteria exist in your mouth, and this is completely normal. In fact, most of these bacteria are beneficial. But there are two types of bacteria called mutans streptococcus and lactobacillus, which are the primary culprits in the tooth decay process. If you're not brushing and flossing regularly, or if your oral environment is out of its natural balance, these bacteria reproduce wildly in your mouth, setting up huge colonies whenever they're given the opportunity to feast on foods that contain sugar. Sugars, which are the building blocks of starchy foods like pasta, crackers, bread, and of course sweets, can build up on your teeth if you don't brush them away regularly. This buildup is called plaque, a sticky film of saliva, food debris, and bacteria that's constantly forming on your teeth. If it's not removed, plaque mineralizes and turns into rock-hard tartar in as little as 24 hours. To survive and multiply in your mouth, the decay-causing bacteria need to eat the simple sugars that are produced from the starches you eat. When they eat these sugars, a chemical reaction occurs within just a few seconds, and the sugars are broken down into simpler elements. One of these elements is an acid. As you probably know, acid breaks down many things, including your tooth enamel. Every time you eat a starchy food, your teeth are bathed in this acid for 20 minutes or more. The acid slowly dissolves the hard protective enamel layer on your teeth, forming a demineralized area that appears as a white or brown spot on your tooth. This is the first visible element of tooth decay. If the area does not remineralize, it will progress until eventually there is a hole on the surface of your tooth. This is a cavity. It's vital that we treat your tooth decay early, before it can penetrate and grow much more quickly in the softer dentin layer of your teeth, which can lead to a much more complicated and expensive set of problems. The good news? You can cut down on the frequency of acid production in your mouth by limiting the number of times that you eat each day. Also, when you brush and floss properly and regularly, there's very little plaque on your teeth. Consequently, the number of decay-causing bacteria on the surfaces of your teeth will be dramatically reduced, and in turn, they won't be producing the enamel-destroying acid. You should also use toothpaste that contains fluoride, which will strengthen your tooth enamel so it's more resistant to decay. And what about the times when you can't brush? You'll need to use other methods, like rinsing with water or a fluoride mouth rinse, or chewing sugarless gum, to minimize the acid attacks and protect your teeth.